The emergence of denial, a dangerous step backward in diagnosing neurodivergent children. In the quiet corridors of public policy and professional medicine, a new form of denial is beginning to echo. Subtle at first, but unmistakably growing louder. It wears a mask of clinical authority and fiscal prudence, but its impact is devastating. A rollback in support and recognition for neurodivergent children, particularly those with autism spectrum disorder, ASD, and attention deficit hyperactivity disorder, ADHD. Hello, I am Dr. K. Paul Stoller, and the short video is about the obfuscation of the explosion in the number of neurodevelopmentally injured children. Once heralded for improved diagnostic tools and early intervention strategies, professionals in the UK now appear poised to reverse course. Rather than celebrating the evolution of awareness and support, a rising tide of skepticism threatens to label these medical advancements as mere overdiagnosis. The narrative is shifting, and not subtly. Now, many experts and policymakers assert that these children are not truly disabled, but are simply the products of pushy parents and bad behavior. It's a disturbing echo from the past. Recall the refrigerator mother theory of the 1950s, which cruelly blamed maternal coldness for causing autism. That theory has since been thoroughly discredited, but its spirit lives on in today's backpedaling. The idea that neurodevelopmental disorders can be explained away as parenting failures is not only outdated, it is deeply harmful. And what's driving this regression? Follow the money. Local councils across England are now burdened with over £4.6 billion, approximately $6.2 billion in special education, SPEED, debt. The pressure to balance budgets is immense, and children with complex needs are being rebranded as liabilities. To reduce the red ink, officials are preparing to strip SPED plans from thousands of students. The method? Deny the diagnosis, erase the data, make the children invisible. This is not a medical breakthrough, it is an abdication of responsibility masquerading as reform. The same doctors who were once lauded for improved detection rates are now complicit in this reversal, too hesitant or too pressured to defend the very children they once vowed to help. Where is the brave voice in the room declaring, "These disorders are real. These kids are really disabled. They need support, not suspicion"? Every parent who has fought for a diagnosis knows it's not easy. It often takes years of advocacy, testing, waiting lists, and heartbreak. No one walks into a clinic hoping to receive an ASD or ADHD label for their child casually. The reality is, these diagnoses are lifelines. They provide access to therapies, accommodations, understanding, and above all, dignity. To suggest otherwise is not just wrong, it is a betrayal. And yet the denial continues to build. Media narratives paint a picture of spoiled children and overzealous families. Policymakers promote the idea that we are simply overdoing the labels. But anyone who has spent time in a classroom, a therapy office, or even just a busy shopping mall knows autistic traits are not invisible. Neurodivergent kids are not rare. What has changed is not the number of children, but our willingness to see them. This deliberate narrowing of diagnostic criteria, this retreat from compassion, will continue until the system collapses under the weight of its own denial. We are witnessing the early stages of that collapse now. The question remains, will anyone in the medical community have the courage to say what must be said? Will they stand up and affirm the reality of these children's lives? Or will they too be shrink-wrapped in silence as the tide of denial washes over yet another generation? This is not the end, but this is the end of this video.